So, coming to the hormonal disorders, we already have some idea, but this is actually a summary or a compilation of all these ideas into one slide. So, one such hormonal disorder is known as diabetes mellitus. Here you can see that the name of the hormone is the insulin. Now, in the case of deficient production or insufficient production of insulin, that will be leading to this disease known by the name diabetes mellitus. And symptoms of diabetes mellitus, everybody know that will be increased urination, there will be blurred vision, weight loss, etc. And problem with the diabetes mellitus is that it is a disorder, metabolic disorder, that can affect any part of your body or any systems of your body, so that it can sometimes lead to different type of organ failure, like kidney failure, failure of your heart. So diabetes is a disease or disorder that can affect any part of your body. Then another disease is hypothyroidism. Here you can see that these are the hormones involved, T3 and T4. And the cause of this hypothyroidism is that thyroid gland is not very active or underactive. And symptoms of the hypothyroidism is that fatigue will be there. The person may be feeling quite tired, weight gain will be there, then the person may not be able to tolerate cold very much. Even if you have a slight problem with the thyroid, you may feel this cold difficulty in managing cold. Then mental depression will be there. So sometimes this hypothyroidism can lead to heart disease and also fertility, because if there is problem with the thyroid, hypothyroid gland, hypothyroidism is that it can affect the menstrual period. So that kind of effect is also there for thyroid. Then hyperthyroidism is that it is here also the hormones involved are T3 and T4, and it is commonly known as Graves' disease. Now symptoms are that there will be loss of weight, there will be faster heartbeat, nervousness will be there. Here also you can find that there will be problems to the heart, and also bone loss will be there. Then another hormone is the Cushing syndrome, and the name of the hormone involved is known as a cortisol. Now cortisol, there is that prolonged exposure to cortisol is the main reason for Cushing syndrome. Now the problem is that the person may be having weight gain, high blood pressure will be there, the skin quite becomes very thin, and the impact on your body is that there is increased risk for diabetes and osteoporosis. People with these two diseases will be having higher chance of Cushing syndrome. Then another disease is Addison disease. Here the hormone involved are cortisol and aldosterone. The main is that any kind of damage to your adrenal gland is resulting in this disease known as the Addison disease. Now the reason, the symptoms may be low blood pressure, weight loss, and fatigue. Then a problem is that it can cause death or a life-threatening stage, or known as life-threatening adrenal crisis, leading to the death of the person. So that is the problem with Addison. Then polycystic PCOS, polycystic ovary syndrome. Here the main of the mostly it is androgen and insulin. It is also causing hormonal imbalance. Then sometimes it can cause irregular menstrual periods, acne on the face, and excessive hair growth is also a situation of polycystic ovary syndrome. Then impact is that it increases the chance of development of type 2 diabetes and also heart disease. So this is an idea regarding PCOS or polycystic ovary syndrome. Then growth hormone deficiency, it is mainly caused by a pituitary hormone known as the growth hormone. The main feature of the growth hormone deficiency is that the height of the person will be very short. Then there will be reproductive development or reproductive maturity will be attaining very slowly. Fatigue and reduced bone mass or muscle mass formation is there. Now developmental delay in children can affect the quality of the life of the person when they are an adult. So that is the problem with the growth hormone deficiency. Then acromegaly. Acromegaly is also another type of disorder affected by growth hormone. Excessive formation of growth hormone, excessive secretion of growth hormone, usually because of a pituitary tumor. Then the difference is that there will be the hands of the person will be quite enlarged, facial changes are there, joint pains are there. It can also lead to heart disease and diabetes. So this is another disease known as acromegaly because of increased. The first case it is deficiency causing dwarfism, whereas increased formation can cause acromegaly. Then hypogonadism, in the case of hormone involved testosterone and estrogen, if the gonads are not working properly, the enough secretion of testosterone may not be taking place, and that will reduce libido. Libido means sexual desire. Infertility can happen. Then that fatigue can happen. Then it can also increase the development of osteoporosis. Osteoporosis means bones become quite brittle and weak. The bone mass will be reduced. Then sexual functioning of the person may be affected. That is known as a sexual dysfunction. So that is because of reduced formation of this hormone. Then hyperparathyroidism. It is PTH. Parathyroid hormone. If there are overproduction of parathyroid hormone, can lead to bone pain, kidney stone, depression, etc. And fear and impact on the body is that it can damage your kidney, or it can result in kidney failure as well as osteoporosis. Then another type of the hormonal disorder is the congenital adrenal hyperplasia. Now here the hormones involved are cortisol, aldosterone and androgen. This is a genetic disorder caused by problems with your gene. Then ambiguous genitalia, the person's genital organ or reproductive organ may be quite confusing. We may not be able to distinguish whether this is a male or a female. So rapid growth will be the early puberty, the faster development of sexual sexual puberty will be there. Then it can also cause infertility and adrenal crisis leading to death. Then pituitary tumors are there, and mainly the hormones involved are prolactin, GH and ACTH. And sometimes benign means not multiplying. So there which tumors which remain localized, and benign tumors in the pituitary gland are causing this pituitary tumor, this kind of situation. A headache will be there, changes in vision will be there, hormonal imbalance will be there. Then this condition sometimes result in acromegaly or Cushing syndrome. Then prolactinoma, the hormone is known as a prolactin. It is caused by pituitary tumor. The symptoms are that there will be more breast milk production, irregular periods in women, and erectile dysfunction in the case of men. So these are some of the problems associated with the high production of prolactin. Then problems with the vision can also happen. So these are some of the various type of hormonal disorders caused by either deficiency or over secretion of various pituitary hormones. So all this you may have studied at somewhere, but this is simply a compilation of all the topic, all those information into one slide.